Welcome to the Mind Frame podcast, where we discuss all things mindset. My name is Tara, and in each episode, I sit down with experts in psychology and neuroscience, as well as individuals who have achieved the extraordinary in the world of business, sports, and beyond. My aim with each episode is to uncover insight into how our minds work and how our thoughts, beliefs, and attitudes shape our experiences and performance. With that being said, let's get into today's episode.
Whether you're just starting or you're at the peak of your performance, what is very common is that it is very easy to self sacrifice to reach that one thing that we're hoping to achieve. But taking care of ourselves can start at the very beginning. And in fact, the more we take care of ourselves, the more we practice self compassion, the better we're able to show up for ourselves, for our colleagues, for our patients. This is what it feels like to save a life. And so by designing an environment where you can increase the signal for appreciation and recognition, then maybe it actually can create an environment that, yeah, we're like Olympians in medicine. We get to resuscitate, we get to do all these cool things, and we can celebrate that.
Today, I'm pleased to welcome Dr. Alvarez to the podcast. Dr. Alvarez is a clinical associate professor at Stanford Emergency Medicine, director of well-being, and co-lead of their human potential team. He is a renowned emergency medicine physician, medical educator, and leading voice in physician well-being and mental health. Dr. Alvarez also serves as the co-director of the High Performance Resuscitation Team Summit, a groundbreaking initiative that brings together elite teams like Special Operation Forces, Olympic athletes, and healthcare professionals to uncover what it takes to perform at the highest level. In today's conversation, we explore the practices that enable Dr. Alvarez to navigate high-stress environments, everything from managing the emotions of a team during life or death decisions, to learning how to embrace failure in the relentless world of emergency medicine. We also dive into the self-determination framework, a powerful approach to understanding motivation and well-being, and how to create environments where individuals and teams can thrive. While Dr. Alvarez's insights are grounded in the intense and fast-paced world of emergency medicine, these lessons go far beyond the hospital that any individual or leader creating a high-performance culture can apply. With that said, I hope you enjoy today's episode. Well, thank you so much for being here, Dr. Alvarez, and thank you for joining the Mindframe podcast.
Yeah, thanks for having me. I'm looking forward for the discussion. I'm happy to share with you some insights that I've learned over the years. Probably a lot of them is after making mistakes myself. And also, I think just navigating uncertainty in our specialty in emergency medicine.
Excited to dive in. Before we get into your work around resilience and well-being, I would love to just hear a bit more about your personal journey. So maybe if you could start about your background and what inspired you to pursue a career in emergency medicine.
Yeah, it's one of those things that I think for every physician, we take a lot of time like thinking through that personal statement, what brought us into medicine. I'm a first generation physician. I immigrated to this country when I was 13, and my grandfather didn't even finish high school. And so for me, the idea of being a physician was something that really started off as a game with my brother and my cousin. As a young kid, we'd always play with war games. Somebody is going to be the good guy and the bad guy, and I always struggled with figuring out like what I was doing. And so I decided that I'll be the physician, so I'll just take care of both sides if anybody got injured. My grandfather took that and would call for me as like, hey, we need a doctor in the house. And over the years, I would actually start learning how to check his blood pressure. I had no idea how to do it. I think I just pretended I was doing it. But he would encourage me to continue doing things like that, referring to me as like the doctor. It helps that my mom is a nurse. She's retired now, but something to like follow her footsteps. It really didn't click until when I was in AmeriCorps. I did a year doing AmeriCorps in Chicago, working in the emergency department. And that's when I realized, I think that I have a lot of respect for those in primary care. It takes a lot of patience and perseverance to take care of their cadre of patients versus in emergency medicine. I think it fits very well with my short attention span. I work with the emergent thing that's happening. And after that, I am very comfortable with patients not following up. It may not be something that I agree with, but it's something that I can respect about them. And I'm always there should they have exacerbations of whatever disease process that I have. And as I'm talking about that, kind of reminiscent to when I was a kid, where it doesn't really matter whether you're the good guy or the bad guy. If you get injured, I'll be there to provide some care. And so I think that kind of stuck with me. Honestly, I think looking back in my career so far, it's one of the most fun part of my practice to be able to take care of patients at their most vulnerable and their most time of need, and also not always having the answer, not always having the fix to what they're going through, but as you mentioned in the introduction, to be there for them as a human being, humanizing us and humanizing them, and being able to connect with them. I think that's the coolest part of the job.
That's awesome. Yeah, it seems like from what I've heard, there's some sort of innate calling or desire that it sounds like you discovered early on and continues to be a passion of yours through your work today. And so maybe if you could explain a bit more in terms of now what your work is like working in emergency medicine. You mentioned you're between 2 all-nighters right now. It's really impressive you're even able to speak to this in between such difficult and long-houred work. Are you working in the ER every day, teaching? Kind of what does your work look like now?
Yeah, I think working in an academic place, I have several roles, but I do still maintain a schedule of clinical shifts. I'm a nocturnist, so I only work overnight shifts. That allows me to understand a lot of the challenges that happen in the emergency department, especially when there's not a lot of resources. I gravitate towards austere environments. Even during residency training, I've done a lot of work internationally or in places where you don't have a ton of resources. It highlights the resilience of the team to be able to come up with creative solutions despite the limited resources. I work in a very busy emergency department. Stanford sees over 100,000 patients in a year. And I think with what has been happening with healthcare post the early stages of the pandemic, we were really trying to understand how best we can take care of our patients in the context of not a lot of space, also increasing complexity, and especially with what's happening in California right now with the fire. I think that many of our patients are also finding that, especially for those in Southern California, they may not have access to the healthcare that they usually have. And so we're seeing some of those patients as well.
Oh, wow. So you currently have some patients from LA coming up to Stanford?
Yeah, I mean, you have patients, for instance, that normally would have gone to San Luis Obispo or that area, but because their system is inundated by folks that now are needing care because several hospitals are closed down in Southern California, that it's natural for them to expand upwards.
Yeah, yeah. Wow. Well, thank you for what you're doing to help with that situation. It has been heartbreaking to see what's happening down there. So, thank you to all the first responders like you. And how do you think about those kinds of scenarios, especially something like the LA fires or everything that you do has to do with emergency medicine and reacting really quickly to a given situation? How do you think about that high pressure and high anxiety that you meet on an everyday basis and have to operate at that level every day?
I think one key thing that I've learned over the years is that it's never just about me. I think that in medicine, especially, there's high propensity for folks to be that you want to help and you want to be able to provide care. And that's why I'm a little bit deliberate about using the word help because if I focus so much on the idea that I am there to save people, then it actually puts me in the dreaded drama triangle. I'm there as a savior. That savior complex can really lead to burnout easily, especially when you're trying to get validation from folks that you're trying to just like solve and help people, right? I think that I have the training and the resources to be able to provide care in those immediate moments. It's intellectually curious for me to do that. It helps me to also kind of understand puzzles quickly, dealing with uncertainty. And surely in those moments, I think that's where the mindfulness come in a lot. the early versions of me, especially immediately after training, I was the one that would try to prove to people that I'm just as good as everybody else, especially moving to California, having trained in the East Coast, in the Bronx. The reality is, we're all actually just struggling one way or another. And being able to understand that in my team, so that when in the moment when we're resuscitating, I can hopefully tease out like when parts of my team members are maybe a little bit stressed out, maybe the way that people are communicating with each other either escalates the tension or maybe account for transfer of communication so that we are focused on the task and at the same time focus on how we maintain that connections that we have, because at the end of the day we may be resuscitating one after another, but we also have to learn how to take care of ourselves and our teams. And so it's that complex dynamics of like being there for other patients and also being there for our team. And also, most importantly, and we're really terrible at this, being there for ourselves and how do we take care of ourselves in those moments. So I think that interplay of that, I find of it, especially in my role as a director of well-being, especially also in the context of high performance teams, that there's simple things that I can do to design my environments so that I can also take care of myself in a system that may seem broken for everybody when the volume is so high, people are frustrated, and things may not be working the way that we would want in our practice.
I think that's something really interesting I've seen reading about your work is how you've brought this area of mindset to the forefront of emergency medicine. And I think a lot of people think about medical training, it's a lot about the clinical knowledge that you have to develop. So, how have you developed that right mindset, and what are those tools you use to be taking care of yourself in these rigorous environments?
Yeah, I will key in on the self determination theory. So, autonomy, belonging, and competence. So, I
Mhm.
think that it's important for me to focus on the competence earlier on. And so, I am grateful to have a wonderful training at Jacobi Medical Center, where it's a very busy county hospital. We got to see a lot of intense resuscitations and also hone in my procedural skills, which is easily one of the most important part of my practice, so that in a busy place like Stanford, where not only do we see high acuity cases, we also see a highly complex environment, things that I have to Google all the time because I've never heard of the disease process that they have, because we are the receiving center for like pretty much everybody. We have access to the world's experts. And I have to be comfortable with that I don't know, I don't have to have all the answers. I just need to know how to resuscitate in that moment. How do I connect people in the system? And how do I also, again, make sure that when we relay that to our patients, it's something that they can understand easily in their however level of education they have. I think your question on how do I get to that point, it's truly because I struggled at the very beginning. In fact, going back to autonomy, belonging, competence, the sense of belonging is something that is easily not achieved in a high performance environment if you're not intentional about it. So, for instance, it is very common for physicians to experience imposterism. In fact, Tate Shanafelt and team have shown that physicians have the highest imposterism compared to any other workforce in this country. And so imagine, just by being a doctor, but just by being a physician, you're already thinking you're not as good as everybody else. So that self doubt is very common. And then you work in a place like Stanford where everybody seemed to be accomplishing wonderful things with really fancy titles. And also, you may be familiar with the idea of the Stanford Doc syndrome, or I call it phenomenon because I think it's not a disease or a syndrome. It's this idea that everybody looks like they're floating serenely in a pond. And yet, the reality is that deep inside, underneath the water, we're all struggling just to keep afloat.
Mhm.
And so, the work that I've been doing in the context of humanizing physicians is that I can be comfortable with my areas of expertise and also understand that I don't have to have all the answers. In fact, one way for me to connect with patients, believe it or not, is to be able to tell them that I have no idea what you have. And part of that is because I need to be able to own what is within my scope of practice, what is within my scope of expertise, which is, do you have an emergency, life or limb threats that I need to address right now? Or is what you're going through something that is real, important, and needs to be addressed as an outpatient or during the inpatient stay? but we don't necessarily have to have the answer in the emergency department. And that's very hard, right? For a physician who has been screened in college, in medical school, questioning you, like, are you good enough to be part of this group, right? That sense of belonging. And to where I am now, where I can accept who I am, show up as myself with authenticity, right? And still be able to do all the fun emergency medicine things that I do and acknowledge that I don't have to have all the answers.
Hmm. Interesting. I think that's a really cool framework to think about, even outside of emergency medicine, something people can think about. You mentioned competence, autonomy, and belonging. So, competence is that foundational education in your field. Belonging, I guess, trying to overcome feelings of imposter syndrome or accepting the fact that you won't have all of the answers. And then autonomy, what is that area?
Autonomy is to be able to practice emergency medicine in my context at the peak of my training.
Hmm.
And so, if I'm in an environment where there's a lot of restrictions of what I can or cannot do, then I'm going to feel like I'm stifled all the time.
Hmm.
So, it may be that folks may find that, like, I feel stuck. Right. So that's very common in my work and in the well being space. People feel like I'm just stuck here. I'm just like a cog in the wheel, but we always have a choice, and that's where mindfulness come in. I think understanding that we always have a choice. It may not be the choice that we want to have, but knowing that I have a choice, I can choose to pursue something that's aligned with my values. I can choose to practice medicine where it's going to be safe for my patients and also safe for me. Or I can just feel like, you know what, I have no choice. I'm just here to take care of the patient. Otherwise, if I don't, like, I'm going to get in trouble. That
Hmm.
feeling like I'm gonna get in trouble not only thwarts my sense of belongingness, but also prevent me from having the sense of agency to actually do the thing that I need for my patient. So a classic example that I can think of is like, I mean, this is Stanford. So people fly from all over the world to come to us. Sometimes it's even like the Center for Miracles because people think that we can just like fix whatever they have. And that's just not the case. But I need to be able to, especially with the rising volumes that we have, if I have a patient who's demanding, like, I need an MRI for my foot because I think that will solve the problem, I need to be able to communicate that, empathize with them, and understand that, like, listen, what you have is real. Like, you're struggling. I get that. And also, MRI is not the best course of diagnostic modality right now,
Hmm.
right? How do I convey that to somebody who's a VIP who's demanding something, right? How do I say no to somebody? Because I think medicine has transformed in some ways into this like customer first, but again, it's good to be reminded that they're not customers, they're patients, and this doctor patient relationship is very important. And so at Stanford, we teach this idea of relationship centered care. It's not patient centered, actually. It's very dangerous to be focused on just the patient because there's a reason why we went to medical school to amass all the knowledge that we have and also the wisdom of like what is the right thing to do in this moment in the context of their presentation. Because if I order MRI just because somebody asks for it, it's going to slow down the emergency department even more, increasing the volume, increasing the wait times, and it prevents me from actually getting the MRI for those people that truly need it in that moment, right?
Hmm.
How do you allocate care when you don't have the capacity to do that for every single one? And how do you do that with dignity so that the person who's you're about, like the patient who I'm about to tell no, can understand that? And I think that's where that self-awareness, that mindfulness comes in. And so, yes, training. So we do a lot of communication training, which I never got in the Bronx because the volume was just so high that we were so focused on just taking care of the patients. But
Hmm.
I'm understanding now that part of taking care of the patients is also the holistic way of they're also human beings. They're just scared. And can I level with them so that they can actually understand my role here as the emergency physician and also the limitations of emergency medicine in the context of their presentation?
Hmm. So it sounds like, especially with the autonomy, knowing both when to say no and how to say no and setting those boundaries for yourself. Really liked how you said it's relationship first, being able to communicate with others in a way that respects them, but also respects yourself.
That's correct. Yeah. And I think that's where the boundary thing that you mentioned is very, very important. It's also not
Yes.
doctor centered care. That's very
Mhm.
archaic. And that's how we used to see doctors. It's like, well, I'm just going to tell you what to do. That's also not fair for the patient, right? Because then if I
Yeah.
don't understand them, And then at the end of the day, when they go home or when they get admitted, they feel like I didn't really respect them,
Mm.
then they're not actually going to follow whatever instructions I give them.
Right, right. It's called the self-determination framework.
Yeah, self-determination theory by DC and somebody else.
Very cool. And so at Stanford, outside of being a professor, you're also the co-lead of the human potential team and also director of well-being. So in both those roles, are these mindfulness practices the types of things you teach and spread in those roles as well?
Yes and no. I practice it. I try my best to practice it. A good friend of mine, Dr. Maria Makowski, mentioned to me she's part of WellMD, WellMD Well PhD Center, and she told me several years ago, probably about 5 years ago now. She's like, there's a study among surgeons that if you just meditate every day for at least 14 minutes, you're more likely to develop the habit and you're more likely to develop the benefits of mindfulness. And so I told her, I was like, because I'm an emergency physician, my attention span is very short. Maybe if I just do 5 minutes every day, that I'll develop the practice. Well, I'm so glad that she told me that. And this is like shortly before the pandemic happened. Now I have been practicing meditation every day for close to like 2,000 consecutive days. Now,
Wow.
yes, that's helpful for me. I get that. But also in the well being space, it is actually very insulting if I teach somebody who is burning out, who is struggling in the environment of healthcare to just meditate, right?
Mm.
You simply cannot meditate and resilience your way away from burnout. So at Stanford, we use the professional fulfillment model. And so there's three parts of that. The first part is the culture of wellness. The second one is efficiencies of practice. And then the third part is personal resilience. For me, mindfulness and meditation falls under personal resilience. And so I model that. I show people that from a high performance teams, for instance, because Olympians and special operations forces, they use mindfulness practice so that they can self regulate their emotions to be able to be at the peak of their performance. You have seen this and probably have talked to several other experts in the field who use mindfulness in that way. In the context of my role, it's really hard to tell people to do that when the culture of wellness is not being addressed. That sense of belonging is not being addressed. The sense of autonomy and agency is not there because of restrictions in their work. That gets to efficiencies of practice, right? And also competence. Are people getting the right training? And so the human potential team within our department in emergency medicine is actually one of the, I'm grateful to have a lot of like cool things to do. And one of them is the human potential team. The team tackles, we call it dilemmas, things that we know are real problems to tackle, but maybe we don't have the right time or the right team or the personnel to really focus on that because everybody is doing wonderful, busy things. For instance, at the early stages of the pandemic, we realized that folks with kids, folks with caregiving responsibilities, tend to suffer more when their loved ones are sick. Then how do you then show up to work when your kid is sick or daycare is closed or like your mom needs a doctor's appointments that you need to be there for them? And so you're torn. You're dealing with this moral distress, which eventually accumulates into this moral injury. You're betraying your family member so that you can take care of your work. And also, the work does not allow you to take care of your family. So, that betrayal from the system. And so, how do you then deal with that? And so, I'm grateful to be in a place where our medical director was like, yeah, we need to expand the way that we see activating our sick call
Mm.
and so we have been extending the way or defining the way that we see activations of sick call. So you don't necessarily have to be sick. In fact, we actually change. We're very good with changing the language that will better highlight what we're dealing with. So now we call it just an on-call shift because it doesn't necessarily mean that you're sick to activate that. It also takes away the stigma that like, well, I'm not sick. It's actually my kid is sick, and yet I still need to show up because I feel like I need to prove to everybody that I'm just as good, if not better, as everybody else. But and so we took away that stigma so that people can actually start taking care of themselves. So in the long run, you can continue to show up. Well, this is 2 years ago now. We realized that our department would have sick calls. I'll just use the word sick call every day, right? Because we have normalized that it's okay to activate the sick call at that time. And so it created a semblance that, like, is our department well? It's like, why is everybody calling out sick? And then my medical director was like, well, you have normalized that it's okay to activate the sick call. And so when we looked into it, we had about 3 times more activations than we've ever done in our department, which meant that every day we had a gap in our schedule, which meant that we're begging people, hey, can somebody cover for this shift? Can somebody cover for the next shift? Sometimes 2 shifts needed to be covered, right? And so the solution then is to not shame people. It's like, hey, we like dialed too far. We need to not activate too much. We have to trust that people are activating the system because they feel that they need to take care of other things, right? And actually, when we look into it, people are not using this maliciously. They really are trying to be there for their family or themselves. And so we had to develop a solution. And so the human potential team thought about it, like understanding using design thinking methodologies, looking at it from different angles. And so the solution that came up eventually is number one, we needed to double the backup system. So now we have a double on-call systems in our department. And also, historically, being on call was just part of the job. So now we've actually now incentivized that. So there's like, it's not a lot, but you get paid a little bit to be on call. And so when we were meeting about this, what was the most significant narrative that came up over and over again was people sharing, I wish I can thank my colleagues who took my shifts when my mom died. I wish I can thank each and every one of you who took my shifts when my kid was sick. In overwhelm, I'm getting goosebumps as I'm sharing this because again, it just humanized us, and it also reminded us that like this department, even though we've expanded to adapt to our environments, that there is still a sense of belonging. And I think that is a big win for the human potential team, not because we now have a double backup system. That's helpful. But most importantly, to highlight that as part of our core values as a department, that we actually take care of each other and take care of our family in this idea of a work, family, career continuum. And so like that is one of the cool part of the human potential team.
Yeah, amazing. I love that. I love how it's creating that sense of belonging within a team to know that you can trust one another and rely on one another in order to perform at that highest level. And I think that was a great example because in my work roles, I've heard like, take your time off, don't check your emails when you're off because it's not life or death. No one's going to die if you don't answer it. But in your role, that's not the case. Lives are on the line and it can be life or death. But the answer is not, okay, then everyone has to be on call all the time. It's how do we create a structure that supports each other to have boundaries and be there for one another and depend on each other so that as a team we perform at our highest.
That's right. How do we show up and practice to the peak of our performance without breaking our back in a system that may be broken, right? It is not. I understand that the system is overwhelmed. System here is just a generalization to healthcare. The system is so overwhelmed right now that yes, of course, it needs a lot more healthcare workers, a lot more physicians to be able to take care of our patients. But if we're not taking care of ourselves in that moment, then I'm actually less able to practice at the peak of my performance when I'm
Yeah.
sick, when I'm not as well rested. So that goes back to like me being here right now. I believe in this conversation. So for me, this is something that's as important as my work. And so that's why I'm taking the time for this. But also, one of the things that I need to do then is over the course of the day, I have some time to sleep and also have blocked off times so that by the time I show up to work tonight, I will have my full complementary of sleep that I need every day.
Yeah.
That I think is the difference between constantly self-sacrificing, which doctors do. A study at WellMD has shown that physicians have the lowest self-compassion compared to any other workforce in the country. And so
Wow.
not only do we deal with imposterism a lot, we're more likely to practice self-sacrifice out in service of others. And so that in service of, that's why I mentioned earlier this idea of the savior complex, because sometimes that line gets blurred. It is important that to understand that our profession is in service of others. That is very true. But the pathological aspect of that is when we do so much of that at the cost of taking care of ourselves. And so I think for us in the human potential team, I believe that if you can dedicate time, resources, and personnel to really tackle things that will prioritize physicians as well, then we can show up for our patients even better.
Yeah. Yeah. Amazing. I think it's something every organization can learn from. And being emergency medicine, you kind of face it in the most extreme scenario, but leaders in any organization can start to think about these principles and how can they create this kind of culture. And I'm also curious, so in terms of the human potential team that was on the organization level, how to prevent burnout, curious for yourself, you mentioned you meditate every day. Are there any best practices that you use to combat burnout or general overwhelm of your role?
Yeah, I think that there's no one size fits all solution for this, but an overarching theme here, I believe, is, remember I said there's the culture of wellness, there's efficiencies of practice, and the third part is personal resilience. I think that personal resilience, what is actually more important is self, at Stanford, we call it self valuation, how much you value yourself and accepting your own imperfections and having a growth mindset in that space. Or Kristen Neff's work on self compassion, which is really like, how can I be kinder to myself, especially when in the moments of struggle, in the moments of uncertainty or suffering, or when I'm just tired.
Mm.
The flip side of that is also like, how do I celebrate my wins when I experience them? Because we are the worst with celebrating wins because we just think, oh, yeah, 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 that's just part of the job. For me personally, when I get goosebumps, I have practiced enough self awareness and mindfulness that whenever I get goosebumps, I can tell when it's like a positive emotion. So I'll give you, this is an example that I've used a lot. And I remember this resident. He's a wonderful practicing physician now, Dr. Andre Bernier. I remember we did the thoracotomy in the emergency department. It's when somebody has their chest has to be cracked open so that we can do like cardiac, like really the extreme like things that you see in the TV show ER, for
Yeah.
instance, right? And it's one of the rare times that I have physically left the emergency department to walk with the whole team to the OR because again, like the patient's heart was like with somebody's hands. And so
Oh
we
my
did
gosh.
this wonderful resuscitation. And as we were walking back, Andre and I, Dr. Bernier and I, were kind of reflecting, and he's like, man, I could have done this. I could have done this better. I wish I did this and da da da. Like, and so he just like rattled off like things that he can improve. And I told him, I was like, dude, can we just pause for a moment? Because I'm getting goosebumps, and I don't know if you are, but I am getting goosebumps. Like, what are you talking about? I was like, this is what it feels like to save a life.
Oh,
So
yep.
there's like, yes, there's a ton more patients to see in the emergency department. In every resuscitation that we do, it never is the finality, right? Like we do something, good things happen, bad things happen. We cannot control all the outcomes. And one of the few guarantees is there's gonna be more patients to see. But if we don't take care of ourselves in that moment, if we don't acknowledge that there's actually something wonderful that we just did, and not just the bad stuff, right? Because that's even worse when you start ruminating of like the shoulda, coulda, woulda, but even just like thinking of like, huh, like this guy lived, survived because of Dr. Bernier. If he cannot feel and understand that, and he's still early in his training, what will happen 5 years, 10 years, 20 years down the road when
Yeah.
you're dealing with all the higher complexities and the changing landscape of healthcare? And so for me, part of my role is to, I'm getting goosebumps again just now, right? Like I get to remind people that what we do matters and that we can have a significant impact in somebody else's lives. And we
Yeah.
can also acknowledge that and celebrate.
Yeah, I think that's great advice because as someone not in healthcare, I think, oh, if I save someone's life today, like that would be a huge win. But for someone like you who faces it every day, it can feel part of the job. And I think for people who, even if you make someone smile today or give them a compliment or like even those smaller things that can happen in your day, note those as a win because it might seem small to you, but if you don't celebrate those things, you never get to enjoy it and have that. It is an act of self-compassion to sit in that feeling, I guess.
Yeah, and also just again going back to that Stanford doc phenomenon, I don't know how much suffering my colleagues are going through right now. And so if I can be an instrument for them to recognize and realize that I am so grateful to be there with them right now
Mhm.
in the misery of things, in the thick of things, like when the wait times are so high, when patients are yelling at us, when all of these things are happening, right? That maybe it can also remind them that like there's a wonderful meaning for their work.
Mhm.
Finding meaning and purpose in our work can have a significant impact on the longevity of our profession. And when people are burning out, part of the reason is that they've lost that, or they don't see or get to appreciate that anymore, right? So even the
Yeah.
definition of burnout using Maslach's is that you lose this sense of accomplishment anymore. And so like
Mm.
by designing an environment where you can increase the signal for appreciation and recognition for our wonderful work, then maybe it actually can create an environment that, yeah, we're like Olympians in medicine. We get to resuscitate, we get to do all these cool things, and we can celebrate that.
Yeah, amazing. And one more question on burnout and overwhelm. I think it's very easy to get overwhelmed, especially today. We're all like dopamine addicted and short attention spans, and constantly it's a new to do list. So, from your perspective, how do you think about this kind of constant daily overwhelm and managing that level of stress?
Yeah, I love this idea of the withins and the beyonds of my control. Liz Follian and Molly, Liz and Molly, they wrote a book on emotions, and they're wonderful people, and they have a couple of books now on this. But I think navigating overwhelm using I have so many different thoughts that come in, and this is very emergency medicine. I'm modeling for you what I would normally do, which is I need to slow things down for myself. So I'm slowing down the way that I'm talking right now so I can think better because I've acknowledged that. So self compassion has three parts. Self awareness is one of them, or mindfulness. The second part is common humanity. That's every single one of us actually gets overwhelmed when there's a lot of things going on. Or in my mind right now, there's a lot of like thoughts. Oh, I can talk about this, I can talk about that. And the third part, which is most important, is self kindness. I'll just focus on what I think is important and I'll share that. And I don't really need to worry about getting it right. And that's not like getting it right and be comfortable with just blurting out some random ideas, but actually just how can I answer this question in a way that also just comes up based on the wisdom that I've accumulated over the years. And so your question is, how do I deal with the overwhelm? It's knowing that I'm not alone in this and that I need to be able to psychologically distance myself from work. And so I can chunk this into a few areas. For instance, we have a resuscitation and the patient dies, right? I think of Patch Adams, the quote in that movie: if you treat a disease, you win, you lose. If you treat a patient, I guarantee you, no matter what the outcome, you win. And so when a patient dies, it's not just about the patient anymore. It's never just about the patient in the first place. It's also the rest of the team and the family member of that patient that dies. And so one of the things that we have done and worked on in our department is how do we find moments to just pause, to acknowledge the work of the team that we have just done for this patient in service of that patient that just died, because he may be somebody else's son or daughter or mom or dad or somebody's sibling. Their life was worth living, and we have been part of the collective team that tried to resuscitate them. So that's important. That's in the moment. And also the self-awareness of, am I hyperactivated? Am I so revved up about this? Like, what are things that have happened in my past? Or like, what is this reminding me of? Right. I remember when my partner's mom died, the first patient that I took care of with the same disease process, I had this emotional reaction, like this grief and also this nervousness and a lot of emotions, right? How do I take care of that while also take care of the patient? Because it's not fair for them for me to be taken away from for all the other emotions that I'm dealing with. And in that moment, it was self-compassion. I needed to quickly acknowledge that. I needed to also understand that I am grateful to now be able to provide this level of care that I can do that I may not have been able to provide to my partner's loved one, right? And then after that, I need to feel the feels afterwards. And so dealing with my own grief because it was so raw and fresh for me. And so eventually that means maybe I need to take time off. And so after, for me, my personal practice, again, this is just my way. I know that I carry stress in my shoulder and my neck. And so I get massages very regularly. I need to do that as part of my self care. Some people hate that. Whatever that thing is for you, I think that is important for us to acknowledge and actually take the time to do. I also plan my schedule, my life in 6 months chunks. Every 6 months, I go on vacation. And when I go on vacation, kind of like what you said, I don't respond to emails. In fact, my away message, if you send me an email over the winter closure, is very long about like I am scuba diving somewhere in Raja Ampat looking for seahorses. And I'm
Amazing.
very detailed about that because I want people, number one, to know that like I'm just as human as they are.
Mm.
I also want to, because I have leadership roles, I want to model that as a leader, it is okay for me to take breaks and that I encourage people to take breaks from work because I'm actually a lot more effective and creative when I come back from those breaks. And so since
Yeah.
intern year, I have been proud to say that I've been able to travel to at least two different countries every year as part of that psychological distancing from work. I also know that it takes me about 10 or 11 days of vacation to completely not think about work. But after 11 days, I'm like, oh man, I can totally relax. But if I only take a 2 week vacation, and then I'm really having like 2 days of free time of not thinking about work because then the last day I know I'm gonna be like thinking about, oh man, I gotta go back to work. My inbox is probably like overloaded, overflowing, and all of that stuff. And so we need to find ways to actually take care of those moments so that we can be better when we go back to work.
Yeah, and really trusting your team as well.
For sure.
And I wanted to go back to that piece about like if a patient dies, for example. First of all, do you see that as a failure? And how do you deal with failure in your work when that failure can be so detrimental?
Yeah, I don't see death as failure. I have to be clear about that. People do
Okay.
see that, right? But I don't because if I do my best, if my team does our best, that's the only thing we can do. I can work in a place where we have a ton of resources, the best resources to actually address the disease process, and the patient can still die. The outcome has nothing to do with the resuscitation that we do. There might be times there that there's like we didn't know, we didn't have the right tool. That's part of the process improvement that needs to happen later on to make sure that we have a high standard of care.
Yeah.
But in that moment, I cannot my validation for the work that I do cannot be dependent on the outcome of the things that I'm doing. It just cannot be, right? Because then I would easily burn out. I
Mm.
cannot control the outcomes of my patients despite my best efforts and best intentions. However, what is also very important is I can control how I show up to folks. And so there are times that I'm exhausted or I just got yelled at by a patient because I've been waiting for so long. And then I go to a next room and now I have to deliver a news that they have cancer or they're dying, right? How do I quickly address that? So it's not failure, but there's also like it's weighing on me. How do I show up for the next person at a maximal capacity that I can without also overburdening them or without me compromising my own like self-regulation? I think
Yeah.
that's very, very important. And I think that gets to your question about like how do I deal with failure? Because I fail a lot also. People, I mean, I'm just as human as everybody else. And especially in a field like medicine, and especially in a place like Stanford, where when we fail, people die. When we make mistakes, people die. But
Hmm.
can we look at it without the naming, blaming, and shaming so we can actually improve the system in the long run? And so for me, the way that I deal with that is I need to separate myself from the environment, from the system. And so there are components of the outcome that maybe we can improve in the next iteration of it. And there are also aspects of the outcome where I will feel guilty, or in fact, I will feel shame. Like
Mm.
that's where belonging needs to happen. That's where support needs to happen. Because if I feel supported, that things do not always happen the way that I would want, then I'm more likely to be present, creative, and relentless in finding the best way to do that in the next iteration,
Yeah.
right? What happened has already happened. I cannot reverse what happened. But if I am in a space of fear, fear of getting in trouble, fear of feeling like I'm not good enough, I am less likely to open up about what I truly thought was happening, right? From a psychological safety perspective, than if I can create an environment where people can feel like, you know what, I struggled in that resuscitation because I thought that was I was seeing my kid that was being resuscitated and I froze. Knowing that, being able to articulate that in the moment is so helpful because then I can find another person to like, yep, you're just as human as we are. Stand here, be here so that you can still continue to learn. But let me ask somebody else to do this part of the resuscitation.
Yeah.
That I think focus on the autonomy, belonging, competence, while also having high standards in the work that we do in medicine. So failure can be seen as different opportunities. How can we improve the system as opposed to failure as I'm bad, the system is bad, and I'm not as good as I should be.
I think it's really interesting how you talked about separating yourself from the outcome. It's actually something, when I spoke with Olympic sports psychologists, that's something that they teach their athletes. And it's not if you win gold or if you medal, it's separating yourself from the outcome and really focusing on the task you have at hand and executing on your training. Knowing that you're more than your outcome, or you're more than if you medal or what you do, and that you have this holistic life, which sounds like you really focus on as well outside of your work. And having those mental reminders can be really useful when it comes to high performance.
That's right. So I think what you said is very, very important, right? An Olympian does not become all of a sudden less than an Olympian when they don't get their gold medal, right? They're still Olympian. They're still like they were still in the Olympics. It's just that not everybody gets a gold medal. The same
Mhm.
for us. Again, that quote of like you treat a disease, you win, you lose. But if you treat the person, the patient, right? That's a win because then that's our ability to be able to give them the best chance possible to address whatever they're dealing with.
Yeah, and you're no less of a person either, as well. And one other area in these high stakes situations I wanted to ask about is with decision making. You have to make so many decisions that are high stakes. So, how do you think about decision making? And especially for people who struggle with decision making, do you have any advice in that area?
Yeah, that is very important. I think that's why I gravitate towards emergency medicine. I don't know if you know this, but we work with very limited information compared to any other field in medicine. Sometimes we don't even know the patient or their name. We just have this body with some vital signs, and we work on their physiology based on what we're seeing. And we're trying different things to, and hopefully it'll work, right? Number one is to trust the process. Like we have a great training in resuscitation. So I have to remember that. I have to remind my residents that when they're nervous about the shoulda, coulda, woulda in that situation. That's one. Number two, that I don't have to be the end all be all for that resuscitation. I'll share this experience. I'm fortunate to be able to number one have sabbatical, and I got to spend my sabbatical in Dharamshala in India, where I had the wonderful opportunity to meet one of the main physicians of the Dalai Lama. And so I asked him, I'm like, how do you deal with this sense of responsibility that you're treating the Dalai Lama? So like if something happens to him, would you feel guilty? And I'm getting goosebumps because he said he's just a human being like everybody else. And also, I'm not the only doctor that's treating him. There's so many doctors in the world. And so the same with me, right? Like when I'm leading a resuscitation, I may be guiding what's happening, but I don't need to have all the information alone. And so that's important for me to then step back and be in that balcony and ask, hey, does anybody have any other thoughts? Or being willing and being open to ask for opinions and feedback in the moment. And so if I'm kinder to myself, I'm not there trying to protect my ego that, well, as the team lead, I need to have all the answers. In fact, one of the coolest part of the job is to be able to be humble in that moment. So like, hey, I'm feeling stuck. Here's what I'm seeing. Here's what I'm trying to accomplish. Does anybody have any other ideas?
Hmm.
Or when I'm doing something and one of our nurses will say, hey, I don't feel comfortable about this. I'm concerned about XYZ. If I'm in my head because I'm so focused about proving to everybody that I'm good, I'm like, I can do this, then I will actually miss those cues that they see something that I'm not seeing because either I'm hyperactivated or simply because they're standing in the other side of the room and they're seeing a completely different picture than I have.
Yeah.
And so, from a teaming perspective, it's important for me to understand that I don't have to have all the answers, that I can rely on my team. And that's truly, it's a high performance team. It's not a high performance me.
Hmm. Very cool. And I guess also once you make the decision, having that self compassion to trust that I made the best decision I could with what I knew in the moment, and having that trust to then make those decisions.
Yes, and in order to reinforce that, having moments to then have we call it debrief, but actually it's more of a diffusion after a high intense resuscitation to just acknowledge the emotions in the room.
Mm,
So, people, again, we need to continue to cultivate a sense of psychological safety. So, people can say, like, I don't know the answer to this, or I'm like worried about this, or I'm like, I was really frustrated about what was happening in that room. How
mm,
can we find a space to talk about that so that it doesn't bleed into the real resuscitation when then it becomes like an ego match?
mm,
And also creating a space so that when people go home, they don't deal with their shoulda, coulda, wouldas, the rumination on their own. And so, a
mm,
way to actually address that is as a team, we can just talk about it so that, like, my perspective and their perspective and like the different perspectives can align and say, here's what we collectively have done here,
mm.
and be reminded of the meaning of our work and creating purpose for the things that we do. So it all connects to that autonomy, belonging, competence, but we
Yeah.
have to be really intentional about that.
Yeah, yeah, amazing. I love the it's a high performing team, not a high performing me. That's a great quote. Well, I know we've reached our time. I really appreciate it. One thing that I ask at the end of the interviews is what is the number one thing you would want others to take away from this conversation when it comes to their mindset? You've worked with some of the highest performers in the world. We didn't get to it, but the high performance resuscitation teams, working with Olympians and people in the military, with all of that background, what is the one thing you would want people to really take away?
Yeah, thank you for this opportunity. Again, this is very important for me because the work that we do, especially, and this is the takeaway that I want people to get, whether you're just starting or you're at the peak of your performance, what is very common is that it is very easy to self sacrifice to reach that one thing that we're hoping to achieve. But taking care of ourselves can start at the very beginning. And in fact, the more we take care of ourselves, the more we practice self compassion. And it's not an easy thing to do. In fact, there's a protocol that they have in the compassion cultivation training at Stanford. It is clear that practicing self compassion is not easy, but it can be done. And the more we do it, the better we're able to show up for ourselves, for our colleagues, for our patients, and also Olympians who practice this, special operations forces who practice this, are able to take care of themselves better. So the data, I don't know what the data is for like other high performance teams, but in medicine for physicians, physicians who practice self compassion are more likely to achieve professional fulfillments, are less likely to face burnouts, and practically speaking, they sleep better because they can prioritize sleep.
Mm,
And so for me, I have so many different things that I'm doing that I'm excited about. I also find time to make sure that I sleep very well.
amazing. Well, great advice. Again, really appreciate it. Don't want to take more time. And I know you need to take your nap before your next resuscitation shift. So definitely want to help you prioritize that. Thank you again and really appreciate you taking the time.
Thank you. And thank you for the work that you do as well. I hope you know that by learning the different ways that we take care of ourselves, that we show up in high performance environments, that hopefully people can learn from that and apply it to their own lives because they don't need to be an Olympian to start practicing the many things that you're able to tease in from all of us here. So thank you. It's a wonderful work that you're doing.
Thank you. I appreciate it. Thank you so
Yes.
much.
Bye.
This podcast is for entertainment purposes only. For more episodes, search for the Mind X Frame podcast where you stream for podcasts, or find us at Mind X Frame Podcast on Instagram. See you next time.